Welcome to episode 50 of the Lebanese Physicians Podcast. And today, our episode will be with Dr. Rola Hammoud, who is the Chief Medical Officer of CMC Medical Center, Dubai, and has been involved extensively in quality in healthcare in Lebanon and the region. And today, our topic will be focused on women leaders in medicine in the Middle East, as Dr. Hammoud is one of the major women leaders in the area. Welcome, Dr. Hammoud, to the podcast.
Thank you for the invitation, Khalil. It's an honor for me, and I look forward really to meet many people, leaders in the healthcare field as well.
Thank you. It's great talking to you today. First, I'm going to start with how did you start your career in medicine? I know that you're an anesthesiologist by training. One, how did you decide to be an anesthesiologist? And then how did your career start in medicine in Lebanon?
Yeah. So I did my medical studies in Belgium at the Université Libre de Bruxelles. And I was accepted to do cardiology as a specialty because I was interested really in cardiology. However, we used to be as a family in Belgium. So my parents had moved to the Middle East, to Egypt, and because I could not continue my studies in Egypt, I moved to Lebanon, and I had the chance to have a position in the anesthesiology department, and I took this rather than internal medicine because I look very, very closely to look at the immediate effect of the treatment on patients. So, and because this, I did choose anesthesiology, which is a field that I admire because it merges the medical field to the surgical field. It focuses a lot on patient safety, and it taught me so many aspects in pain management and in managing patients during surgeries, specifically complex patients. So I did my anesthesiology studies at the American University of Beirut, and then I continued further fellowship in the UK, in the Midlands area, where I, if you want, refined my practice in obstetric anesthesia and in intensive care management.
Yeah, and I always enjoy working with anesthesiologists as we're doing our bronchoscopies, and it's always important to have a good relationship, and good anesthesiologists are always good to work with. And so what led you, so we discussed a bit about safety, so what led you into the medical administration field, specifically initially into the quality and safety field? How did you decide to pursue further studies in that field?
Yeah, so actually after I came back to Lebanon, once I finished my fellowship in UK, I came back and I practiced in different hospitals in Lebanon. And the anesthesiologist, he doesn't have a clinic outside the hospital. It's all hospital processes, hospital work. And because we are in different places in the hospital, we are in the operating room. However, we can be in the ER. As you said, we can be in the bronchoscopy suite. We can be in the cath lab, in the MRI suite. So we administer really anesthesia in the delivery suite. So we administer anesthesia in different areas in the hospital. So my curiosity drove me to understand the processes and to dig more into the reasons behind, sometimes unsafe practices that we do. Because, anesthesia is a very, very safe practice in medicine. Actually, many studies show that after cardiac surgery, it is the safest practice, the safest specialty in medicine. So I got interested in safety and in quality. I was managing the operating room in all hospitals I worked at. And I don't know if it was something from within that showed that I'm interested in management. However, I suddenly found myself in managerial positions like director of the operating room, chairing the OR committee, member of the medical board, the head of the anesthesia department. And so I was obliged, whenever I accepted those positions, I was obliged to be fit for the position. So this is how I decided to pursue further studies. And I started by studying management at a really very basic level, which is doing courses just to understand the management itself. In 2005, I moved to Clemenceau Medical Center. And as a regular anesthesiologist, I did not have any managerial positions. And I was so happy moving to an institution that is paperless. So I started understanding more the electronic medical records, how it works, how can we improve the system, how to get physicians to implement this system, because it's a new system and physicians are used to hard copies, so it was a bit difficult to make them to convince them to go to the electronic. So managing the resistance, suddenly the management at Clemenceau appointed me as the chair of the Clinical Data and Documentation Committee to help in this. And we started really a journey where we established the standards, and slowly I got involved into quality management. And because we were affiliated to Johns Hopkins International, we were involved also in preparation for the JCI accreditation. And again, I was appointed as a medical quality director, and suddenly I found myself obliged also to do further studies in order to fit the position. Sometimes you have the skills, however, you need the knowledge. You can learn the knowledge through experience, but I wanted to have it through both ways. So this is how I got my diploma at the ESA Business School in Beirut, which is affiliated to Paris 7 University in France. And afterwards, I did the further diplomas in coaching, in executive coaching, in mediation. And then I went to Harvard Business School to do an executive certification in healthcare management. And the last diploma I did was in corporate governance. That was 2 years ago. So this is the track. This is how I did it, really, the experience with the knowledge. And after a few years also, I was appointed as Chief Quality Officer, where I was leading the whole quality improvement processes at Clemenceau Medical Center, Beirut. Meaning, not only clinical, it's also operational, and really building a culture of quality and embed this culture in the people working at the hospital was really the target and the objective of my work as a Chief Quality Officer.
And was it, so I know, in Lebanon, sometimes it's like introducing these concepts sometimes can be difficult just because of, I think people are used to working a certain way, and then you have to change the way they work. So was it easy, or was it a pretty
process? It was very challenging. As I told you, there is resistance from different parties to implement the processes, the standards. However, when you succeed and you celebrate success with everyone, so everyone would know what it means. And really, in Beirut, we managed to have many accreditations, not only the JCI. We applied to many awards, and we were able to get it because of the work that we were doing, whether it is at the patient safety level, at the performance improvement level, at the accreditation level, at the risk management level. And after a while, I felt that it's not all about the people and the patients coming to CMC. This should be really for every patient in Lebanon. And so why is it that the patient in CMC should be safer than a patient in another place? And this is how the idea of building the Lebanese Society for Quality and Safety in Healthcare came to me. Actually, I used to attend many conferences and meet many international speakers and see how the other countries are doing it by having societies to discuss about quality and patient safety. And here there was a challenge in founding this society, because I could not find the way. Where should I go? So I went to the Lebanese Order of Physicians, and then I noticed that no, it's not only about physicians. In this society, it should be multidisciplinary, and we should have more stakeholders than physicians. So We have nurses, we have dietitians, physiotherapists, administrators. So I went to the Ministry of Public Health, and the Ministry of Public Health, they said we should be like a dog watch, and if we establish something within the ministry, it will be we are regulatory, and if there is any society like this, we will be obliged to take actions. And actually it was not the objective of the society, not to look into errors and highlight and pinpoint errors. It's more about improving the health care systems in Lebanon. So I was advised to establish an NGO, and this is what we did with a group of colleagues who were really very helpful. And we established the society. We built it with an objective of becoming an educational forum, a training forum, and to perform regular scientific meetings and workshops and trainings. And really, we were very successful. We performed every year a national conference. We invited international speakers, so we brought people to the region and to Lebanon, and we allowed all quality and safety personnel and advocates to attend those meetings and to interact with those speakers. We did workshops as well. So it was really opening the door for those who cannot go abroad, who cannot learn it this way, to bring the information to them. And we also did like yearly workshops, one on patient safety, one time we did on medication safety. So every year it was a different topic, until really the economic crisis came, and of course there were like it's a period of 3 years where you have presidents, and there were elections of other colleagues, Dr. Ubarasi, Dr. Ms. Rola Hammoud. So they were all on the same track towards the same objective, which is really building capacity in Lebanon in this field.
So you were basically representatives from a lot of the major hospitals, and maybe other hospitals in Lebanon were present in this committee. Because prior to establishing it, there were no, let's say, quality metrics set by the Ministry of Public Health, right?
Well, prior to this, the accreditation has started in Lebanon, and I think Lebanon was pioneer in this. In 2009, we established the standard a bit before, perhaps in 2004. The Lebanese standards for accreditation were established by the Ministry of Public Health, and they were renewed afterwards in 2009 or 2012, I cannot remember. So within those standards, they do say, yes, we need to establish quality metrics, and each hospital has to establish its own quality metric. However, for us as a society, the last project that we worked on, it was in collaboration with the WHO. And we worked on having a patient safety forum for all hospitals, and on building indicators and metrics for all hospitals to measure themselves and to report them. And the ideal would have been to create a benchmark between all hospitals, an anonymous benchmark for hospitals to know themselves where they are, how they can improve. So what we did, we established like national patient safety goals. Those are based, we identified those goals when we looked at the journey of the patient from his admission until his discharge. And for each step of his journey, we established few goals. And then those goals, we had the support of the Ministry of Interior we created like a video as an awareness for patients, for community in Lebanon. And we had this video going out on TVs, just as as awareness, and for patients to know that their safety is a right for them. It's not something that we consider that is يعني مش something parallel. It's really a core thing within the healthcare systems, and it should be really on the top of the mind of each healthcare leader in every healthcare system. So we established those indicators. We even did the training sessions for, we did a pilot study. We involved 5 hospitals. We trained them on how to collect the data, how to analyze the data, and how this will help them. And the last step was to create like an electronic platform to perform the benchmarking and to upload the data on this platform. And now my successors are continuing to reach this goal.
So they are working on reaching this goal, but probably it's slowed down because of the economic crisis.
Correct.
But I'm sure they will get there at some point in the next.
Hopefully. I mean, what is so amazing in Lebanon is that, those small, although you don't have a structure, still you have those small parties of people who can make a difference. And I think education and training is very important to do this difference.
Right. Most small individual and maybe collective efforts are able to overcome some of the lack of structure that is present in the country. And so what led you? I know CMC decided at one point to open up in Dubai. And how were you involved in this? And how did you end up moving to Dubai and becoming Chief Medical Officer at CMC Dubai?
Yes. So in each career, Khalil, I don't know, perhaps it's only me. After a few years, you get bored and you want a change. You want to do something different. You want to do something en plus. However, being at CMC, I could not feel that there is a better place than this in Lebanon. So I started looking outside, and this is where I started also teaching at the universities, giving lectures on risk management and helping the Ministry of Public Health for the accreditation standards, because really I wanted to always do something in parallel to my full-time work at Clemenceau. So looking for a change, I was approached by different hospitals here in Dubai and in the region, asking for a chief quality officer or an anesthesiologist. And I wanted really to keep the administrative part. So our CEO in Beirut suggest that instead of moving with other hospitals, no, you stay with CMC, and the CMC is expanding, building abroad. So it's worth perhaps going with CMC to Dubai. And here I started the work with them to consult for Dubai and to give opinion. We created recruitment committee to recruit physicians. We used to come and go to see the progress of the work until in 2019, I moved here as a chief medical officer. So my role here is to match the quality and the medical administration together in order to have a solid medical team and medical body.
So basically, you started at the hospital from scratch, like you were involved.
Yeah, well, before it was, yes. So basically, when I moved here, the hospital was not handed over yet. It was still in the building phase. So I moved in October 2019, 1st of October, and they handed over the hospital to us, and the contractors handed it in January 2020. And we started commissioning and setting the systems, setting the processes, agreeing with the insurance companies until end of March, where COVID hit and the lockdown was there. And this was really the challenge of my life.
There were, I guess, several challenges. One is starting a hospital from scratch in Dubai, which is already a competitive environment over there, and setting all the systems in place. And then the challenge of everybody at the time dealing with COVID and the unknown and unexpected consequences of the disease. But it seems like despite these challenges, the systems were set in place very quickly. And the hospital was, or the recruitment process was quick to build up a good or an extensive medical staff at the hospital. So how did you manage, or how did you and the team manage to do that? Because I know it's not one person, it's a team of people.
No, exactly. The many challenges, Khalil. You're coming to a new country, you have different rules, different regulations. You need to know about those. You need to understand the market. It's a completely different market, very competitive market. You need to understand the demographics. The population is a young population. And at the same time, in parallel, we need to recruit high caliber physicians because this is our way of doing things. And this is how we did it in Lebanon. And we wanted to continue because the brand is the brand and we cannot really compromise. So recruiting physicians from all over the world, our personal contacts, the team, who was on the credentialing committee, they knew, each one of us had friends around the world. And we started from there. Actually, when we started, we were 11 physicians and we were due to have the rest of the team joining in April. And then lockdown was announced and the team could not join. And we had only us 11 physicians we had to manage. We were obliged to open the hospital for COVID patients, although we were not ready yet. However, it was a pandemic and we were obliged to do this. So we opened the hospital. Sometimes it was part of the risk management concepts that you have. Sometimes you want to start anew and you start by really very, very nice cases, small cases where you don't want to compromise. You want to test your systems. You want to see everything is okay. And now we started by a huge challenge. We started by intubated patients. We managed like 16 intubated patients at a time. And alhamdulillah, the mortality rate was below what was announced internationally. We are so proud of what we did, and even the Ministry of Health recognized this and recognized all the support that we provided in such a primitive. The hospital is well equipped. However, the human resources were lacking.
Were lacking at the time. Yes, that's a tremendous effort. And so, how many beds is the hospital now?
Yeah, we are 95 beds. We can go up to 100 beds. We have all specialties, except we don't do pediatric cardiac surgery, and we don't do burns, and we don't have radiation oncology. And other than this, everything is available.
So between March 2020 till now, how many full-time physicians are there, and how many part-time physicians are there?
So we grew up now. Today I have 75 full-time physicians to include all services physicians, anesthesia, radiologists, laboratory, pathology, emergency medicine, ICU, and hospitalist, plus all other specialties. And I do have 25 visiting doctors from Beirut and around 30 physicians locally established who work on a part-time basis. We have also, on top of this, just started the Johns Hopkins visiting program. We are receiving doctors coming from Johns Hopkins to the region. This is something, we were the first hospital in Dubai to affiliate to an international, an American hospital. And this is because CMC is a very, is a very safe place and very advanced place for those physicians to practice at.
And as a woman, so you're a woman leader in the region, and I think the region is moving forward tremendously over the past years now. but did you feel some challenges being a woman leader, trying to recruit physicians and build up a hospital and move things forward in the region?
صراحة, being at CMC, I've never noticed this. I mean, in general, at CMC in general, the diversity is well respected and wanted. We work, there is equity, and we don't feel that women are less than men. Neither in Dubai, صراحة. In Dubai, it was a very nice experience. بالعكس, you visit governmental places, and people are very respectful for women. They value them, and many places they do have women leaders here. Challenges, yes. Challenges are the same for a woman, even in the States. I think I've read many articles that only 27% of women are in managerial positions out of the 50% of the global work. Although women are half in the global workforce, 27% only reach the managerial positions, and even less they reach to the executive positions. The challenges,
and on top of that, I think the pay everywhere, even in the US too, the pay for women is always less than the pay for men.
Yes. So it's not very different from the international way. It's not because it's Dubai or Lebanon. On the contrary, I feel that I am equal to any leader, and I can do. I mean, the performance is based on different criterias, and when you have built your family and you've been through, you manage your time well to have your children, khalas, you don't bother about them, so you can still give at the same level of a man, and there should be no difference at all, really.
Right. And who has been an inspiration for you? Like, who would you say has been an inspiration for you along the way?
Yeah, many. I mean, as a female, you say as a female leader. Yeah, many people in my life really affected me. I used to have, my mother as a child, although she was not working outside, but she used to be at home for us because my father used to be outside all the time, being previously in the military and then as a diplomat. So she compensated for both. And this also inspired me really to be the mother at home who cannot compromise her children for the sake of the work, which my children don't believe this way. They still believe that it was not done properly. However, you compromise lots of your social life if you want to stay with them at home. And during my career, I had many teachers, many colleagues who really left a print somehow, whether it is it's either something on your daily life that you are impressed by someone and you just say, I want to do the same. It's unconscious. I have a very close friend, Dr. Vanda Abirad.
Yeah, I know it very well. I love Vanda.
Yeah. So, for example, she left many. She's someone that inspires me a lot. Dr. Lubarasi, who is a member with us in the society, is also someone really I admire. So, many people who are in the same situation as me. I think we give each other this energy and those ideas.
So what is your advice for future women leaders who want to follow your path?
My advice is to persevere, to continue, to believe in what you want and to believe in what you do. and to have a purpose in life. The more we grow, the more this purpose becomes clearer, and to never stop, because there are always, and there will be always somewhere, someone in need for our knowledge and our skills. So just we can give it in a very different way. I mean, perhaps in a few years, I will not be in the same place. I'm looking perhaps forward to go into education, into training, into consulting, into advising. And this is how we maintain the momentum, and how we build new generations, and we build capacity for a field that really I admire and I like. And the healthcare systems in the whole world should be really up to very, very, very high standards, because the human being deserves this.
And finally, what are the future plans for CMC Dubai moving forward?
So CMC Dubai will continue to grow. We will continue to have new services, and we will continue to excel in administering those services. CMC Dubai, as I can see it, will become a hub for the region. It will serve not only the community of the UAE, it will serve the JCC community. And of course, because we are sticking to our mission and our vision to stay up to the highest standards of healthcare.
Thank you, Dr. Hammoud, for being on the podcast. I think we were able to, in this short period of time, we were able to discuss your career path, your involvement in quality and quality improvement in Lebanon, and then your establishment of a hospital in Dubai. That's tremendous work. And thank you very much for being on the podcast.
I thank you very much, Khalil, and all the best.